Modern neurology excels at targeted intervention. A pharmaceutical molecule binding precisely to a single receptor transformed outcomes for acute crises like stroke thrombolysis. However, patients with chronic conditions like Alzheimer's, Parkinson's, and multiple sclerosis often continue to decline despite following guideline-directed care. Clinical outcomes are frequently marked by residual symptoms, the complications of polypharmacy, and progressive end organ damage. Chronic neurological decline involves systemic biological dysregulation. This complexity suggests targeting a single receptor is insufficient for managing the disease's full progression. This chart outlines the integrated medicine journey, starting with conventional Western medicine at the top. To support these treatments, healthcare models are incorporating organ protective co-therapies. Moving clockwise, yoga and Ayurveda represent evidence-informed biological interventions. These practices function as interconnected vectors alongside conventional therapeutics. We will now examine the biological mechanisms that allow behavioral interventions to physically influence disease states. This deconstruction focuses on three pathways: HPA axis regulation, activity-dependent neuroplasticity, and modulating chronic neuroinflammation. Acute survival is only the first step. Long-term recovery requires systemic biological preservation to maintain organ function and improve quality of life. Peer-reviewed meta-analyses have begun to document the impact of yoga across a broad spectrum of neurological disorders. In stroke rehabilitation, studies report significant improvements in gait speed, balance, and functional mobility. For Parkinson's disease, regular practice is associated with improved postural stability and better motor scores on the Unified Parkinson's Disease Rating Scale. This data grid maps these improvements alongside multiple sclerosis, where clinical trials show a marked reduction in fatigue severity. These outcomes occur across distinct pathologies, from dopaminergic degeneration and immune-mediated demyelination to ischemic brain injury. This raises a mechanistic question. What shared biological pathway allows these interventions to influence such different disease processes? The answer lies in the physiological foundation of the human stress response and the mechanics of recovery. The autonomic nervous system is the principal interface between psychological stress and physical disease. Chronic sympathetic activation, the persistent fight-or-flight state, drives many of the complications seen in chronic illness. This model illustrates the hypothalamic pituitary adrenal, or HPA, axis. High sympathetic activation pulses through these pathways, leading to sustained elevations in cortisol and catecholamines. This hormonal surge creates cardiometabolic strain, which can impair the body's ability to recover from neurological injury. Yoga asanas, when synchronized with slow diaphragmatic breathing, stimulate vagal afferent pathways. This vagal stimulation shifts the HPA axis toward parasympathetic dominance. As the pathways turn blue, we see the suppression of the stress response and a subsequent drop in cortisol. Physiological markers confirm this shift through reduced resting heart rates and improved heart rate variability. This autonomic stabilization complements the Ayurvedic focus on circadian alignment and neuroendocrine balance. Stabilizing these rhythms supports sleep quality, which is required for the glymphatic clearance of metabolic waste, including beta-amyloid proteins. The sustained elevation of stress hormones creates a biological environment that competes with the processes required for neurological repair. The adult brain retains the capacity to reorganize its structure through activity-dependent neuroplasticity. High cortisol levels associated with chronic stress can inhibit this plasticity and have been linked to reduced brain volume in key regions. Brain-derived neurotrophic factor, or BDNF, is a protein essential for neurorepair, synaptic plasticity, and memory formation. This image shows the relationship between behavioral intervention and neuroplasticity. Focused movement and attentional training trigger the upregulation of BDNF. Clinical data suggests an inverse relationship. As these interventions lower cortisol, they simultaneously increase BDNF expression. At the cellular level, increased BDNF supports the formation of new dendritic branches and strengthens existing synaptic connections. These microscopic changes correspond with structural evidence from MRI scans, which show increased hippocampal volume and cortical thickness in practitioners. These structural adaptations demonstrate that coordinated movement and breathwork serve as physical tools for restoring motor and cognitive function. Chronic neuroinflammation and oxidative stress are recognized drivers of Alzheimer's, Parkinson's, and MS. The progression of these diseases is linked to a cascade of pro-inflammatory cytokines that accelerate neural decay. This diagram illustrates how yoga rebalances the body's inflammatory system. The blue section highlights the downregulation of C-reactive protein, IL-6, and TNF-alpha. To halt disease progression, the suppression of this inflammation must be combined with the repair of existing oxidative damage. The green section of the diagram shows the simultaneous increase in endogenous antioxidant defenses, specifically superoxide dismutase and glutathione. The integrated healthcare model incorporates Ayurvedic botanicals such as curcumin and boswellia to support this environment. These botanicals have been shown to inhibit inflammatory mediators and leukotrienes at the cellular level. Recovery depends on this dual action, extinguishing systemic inflammation while rebuilding the body's antioxidant capacity. Autonomic regulation, neuroplasticity, and inflammatory balance form a unified biological defense against the progression of chronic disease. In modern healthcare, a clinical timing lag often means interventions occur only after a patient reaches an acute emergency. Anticipatory medicine shifts this focus, moving from the reactive treatment of established illness toward proactive health recovery. This interface demonstrates how continuous physiological monitoring establishes a personalized health baseline. Data on heart rate variability and sleep architecture feed directly into a predictive AI matrix. AI models can identify subtle deviations from this baseline, such as emerging autonomic imbalances, long before they escalate into clinical symptoms. These early indicators allow community health navigators to deploy precise interventions, such as specific yoga practices or nutritional modifications, early in the disease trajectory. Precision longevity focuses on the active, daily epigenetic regulation of health through environment and behavior. Protecting neurological health requires synthesizing the predictive power of digital monitoring with system-wide biological interventions to stop decline before